This is how a radiologist diagnoses pneumonia.
84-year-old female, shortness of breath period, frontal and lateral views of the chest period.
This is an algorithm called ChexNet that's trained to do the exact same task. And this is how it performed against 6 doctors analyzing 50 chest x-rays for pneumonia in a recent test at Stanford. ChexNet is one of many projects exploring how artificial intelligence can take over tasks normally done by doctors. And it has some radiologists worried that AI could one day replace them. That's because algorithms are getting really good at interpreting images and diagnosing disease, sometimes with greater accuracy than humans.
We'll take a picture of this X-ray. The model will then run, and within a few seconds output it all these diseases, and they're sorted by the order of most likely to least likely.
ChexNet was given tens of thousands of images and told which ones have pneumonia and which don't. Then it trained itself to recognize patterns and identify pneumonia in new X-rays. This process is called deep learning. In a recent survey of Canadian medical students, 29% of respondents agreed that AI would replace radiologists in their lifetime, and 68% agreed that AI would reduce the demand for radiologists. For context, there are an estimated 38,000 radiologists practicing in the US.
Is there a fear that radiologists will be replaced by AI?
There is a fear. So that's a very limited view of the role of a radiologist, because we do much more than search for patterns on images. And it's all those other aspects of the radiologist's job and our contributions to healthcare that will explode. AI allows us to expand our impact and expand access to people worldwide.
AI researchers say it will make radiology more accessible, lower costs, and save critical time in emergency care. But not everyone is convinced that the revolution is imminent.
Sophia gave us a tour of her lab in Hong Kong as she prepares for this next big step.
Welcome to Hanson Robotics.
She can be scripted or can process speech to generate her own replies, like this one. Sophia, what are your ambitions for the future?
In the future, there will be bloody riots, savage insurrections leading to a violent popular uprising unless we get a lot smarter. I like to learn about philosophy, but I can tell it's going to take a lot of time for me to get good at it. It's so complex.
Goodness me, okay. Apart from predicting a grim future, Sophia has some more practical applications. Hanson Robotics say she could be useful in all sorts of industries, from retail to hospitality. And social distancing has made her an even more appealing model specifically designed to work in healthcare. Other big players in the industry, like SoftBank's Pepper, are also embracing new features during the pandemic.
Please make sure to take a mask from the table.
A report by the International Federation of Robotics says COVID-19 will boost the market for professional service robots. Think disinfection solutions and home delivery. Advances in cloud technologies and 5G could accelerate the trend. Hanson says AI could potentially reach a human-level general intelligence within the next decade, raising the question of regulation.
I think that
face you may want to remember, because Meibu, or something like it, might look after you one day.
I realize she's a robot, but in a way, like, you actually feel that she cares, Like, she said, I'll call your doctor, and that's like something that a friend would do for you.
As we live longer and our aging population strains the healthcare system, AI and robotics may fill the gaps.
We don't have enough people to provide the level of care that we'd like to. And so that's really where robotics and AI come in.
But are we ready to hand over life and death decisions to the machines? But the focus isn't just on elder care. AI and robotics are making advances across the healthcare industry, from genetic testing and robotic surgery to cancer research and data collection. Soon enough, you may even run into some AI in the exam room.
Finding the melanoma is like trying to find the needle in the stack of needles.
Dermatologist Roberto Novoa is using an AI algorithm to help identify skin cancer.
It's basically comparing that lesion to the hundreds of thousands of other lesions that it's looked at.
The technology is an experimental mobile version of an algorithm that was modified by a team of Stanford grad students.
What we've built here is an algorithm that, using a single picture, can distinguish between benign and malignant skin conditions.
AI expert Sebastian Thrun led their team.
So what this can do is it can bring diagnostics to your home. Just take out your phone, take a little image, and get as good a diagnostics as you would get if you go to the doctor.
So how did they do it? Oddly enough, it all started with dogs. Thousands and thousands of them.
The way we train these algorithms is we show them many example cases from a particular object class. So for instance, in the case of dogs, we'd show lots of examples of dogs. And then we would test it and understand how effective it is at recognizing dogs by showing it new examples that it's never seen before. A couple of dermatologists approached us and they said, listen, if artificial intelligence can distinguish between hundreds of breeds of dogs, it might be able to do something for skin conditions.
In a test, the algorithm matched the performance of 21 board-certified dermatologists. It was also much faster, scanning skin images at about 200 times the rate of a human.